Marley Media TV presenta al mejor podcast de emprendimiento, Entre Socios. Juntos crecemos entre socios.
Hi everyone, we're here at another episode with Entre Socios. This time we're here at Enso Plastic Surgery with Dr. Dev. Dr. Dev, welcome.
Thank you. Nice to meet you.
Nice to meet you too. And today we're going to be talking about a very special topic, which are extraction.
Explant surgery.
Breast explants.
Yes.
How will you say that?
Explant surgery.
Explant surgery. It's interesting because a lot of the women are excited about implants,
Right.
but they never talk about the moment where they have to do their explant. So talking about this topic is going to be very important for today's conversation, and you're going to be learning a lot. So before we go into the topic, Dr. Dev, tell me a little bit about you. Who's Dr. Dev? How did you start it? Why did you pick this career? And why specifically, cosmetic surgery, but in the explant specialty?
Absolutely. So my name's Dr. Dev. That's what everyone calls me. I am a double board certified plastic and reconstructive surgeon. I've been in practice in Miami for about 8 years. Career practice has been 10 years long. I was born in Rhode Island, and our family moved to India when I was 8 years old, and then I moved back to the US when I was 18. So my parents are still in India, and I came here to study, and I've lived all over Michigan, Missouri, Boston, Chicago, Philadelphia, all the cold places.
How do you end up in Miami?
Because I needed to keep my tans.
I think you wanted some cafecito, right?
Cafecito, and I feel like the Latin culture, Miami culture is very similar in vibes with the Indian culture. So I felt home here when I visited, and I love being by the beach. So I always wanted to have a practice in Miami. That was one of my goals and my dreams when I was in training, and so moved to Florida and then made it happen. So I'm thrilled to be here in Miami. So that's kind of how I landed up here. The reasons why I got into plastic and reconstructive surgery. So I was in a bad accident in India. I was attacked by a tiger. No, just kidding. I was in a car accident.
I almost believe that.
It sounds more fun, but I was in a bad car accident, and I had some severe injuries to my eye. And I needed about 3 surgeries to fix it. And I didn't understand exactly what that plastic surgeon had done for me until I started learning more about the anatomy and biology of it. And I was amazed that he was able to save my eyelids. Both my eyelids came off. He used skin and tissue to reconstruct it. So I had a personal journey where I felt very connected to the field emotionally, and from an investigative and trying to understand its standpoint. So that kind of led me in that direction. I did explore other options of medicine, but I always felt at home with plastic and reconstructive surgery, where form and function, anatomy takes place, and it's a very artistic field. So those kind of felt like home to me. So that was kind of my starting point with.
Well, that's a very important reason why you started, because you had a personal experience. And because a lot of people tend to think about plastic surgery as, the women being, wanting to show off and being, changing their body and things like that. But in your case, that's why you specialize in reconstruction, because that's as important as any other surgery.
Yeah. And I do enjoy the aesthetics part of it. I think it's challenging, but it's rewarding, and you're using anatomy and tissue. But with my particular surgeries and specialty with the explant surgery, it's a perfect blend of the aesthetics and the reconstructive that come together for the patient. So.
And how long have you been practicing?
In total, 10 years. In practice, actually, I'm coming up to my 10-year anniversary, so I've been in private practice for 10 years.
Great. And doctor, besides the implants surgery, reconstructive surgery, what other type of surgeries do you also do?
Yeah, so majority of my focus is on the implant removal, explant surgery, but I also love doing body contouring. So a lot of our patients who actually do explants will end up doing a tummy tuck, with liposuction. I call it a natural mommy makeover because I'm
Okay.
removing implants. I also do, especially with weight loss procedures now, the GLP-1s, Ozempic, etc. We're seeing a lot of
You need to
patients with
remove.
skin excess, so I do a lot of body contouring for skin excess, bra roll lifts, thigh lifts, arm lifts. So all these contouring procedures, skin reconstruction, organizing procedures, I enjoy doing those as well.
Yeah, that's definitely reconstruction. We're gonna have to talk about that.
Yeah, and interestingly, with the implants, it's not just the breasts. I've taken out implants from all over the body. I've taken out buttock implants, calf implants,
Okay.
bicep implants, tricep implants, pec implants, chin implants, nose
My
implants.
God, I
Yeah.
didn't know all of those implants existed.
Yeah, they believe me. People put implants anywhere in the body, and
So
I've taken
any
them.
type of implant removal, you're the doctor for
I
that.
have good experience in it. Yeah.
That's amazing. And what challenges have you found? What are the most I don't want to say the term rare, but I want to say like what have you found in your practice when removing an implant?
Yeah.
What are the most exotic,
Yeah. Yeah. I mean,
what have you seen?
we've seen, you can name it, we've seen it. I mean, I've seen implants with mold growing on it. It
My
almost
God.
looks like a black mushroom that comes out. Absolutely disturbing. I've had a patient that had 4 implants inside of her, so 2 on each side. They had put them stacked on each other, which is...
And wow.
Yeah. Yeah, so she had 2 and then she went back and they put 2 more, and so she had 4 implants. That was probably one of the wildest cases I've
The
done.
wildest.
We've taken out implants where there's fluid in it, and when you open it, it just bursts fluid out of the breast, pus coming out of the breast, eroding into the chest wall. We've seen sutures. I mean, you name it. We've kind of dealt with all the cases, difficult cases with it.
And you being not only a surgeon but also an entrepreneur, how have you been able to manage your time in being a doctor and also a business owner, right?
Yeah, when you're in medicine, they don't teach you the business side of things. Luckily, I've had the opportunity of having some amazing mentors that have helped me and guided me through some of these processes. These mentors are in Boston and Philadelphia, my parents, family members. So they've helped groom me to become an entrepreneur. My goal was always to have a practice that represented my brand and philosophy, and that's where Enso Plastic Surgery came into play. And so, yeah, no, it's definitely... It takes up a lot of time, weekends, but it's exciting, so it doesn't feel like work to me. I love coming to the office and operating and treating patients, and then I always enjoy kind of analyzing the business aspect of it. Most importantly for me is patient satisfaction, and if your patients are happy and you have a great team, then everything lines up together. So I'm still learning as an entrepreneur. I'm still learning the business side of things, how to make things better. I think it's a continuous learning process, but balancing is just it's more passion than anything else.
It's more passion.
Yeah,
Definitely. And talking about the clinic, how is this clinic and the practices, the way that you run the practice, is different from any other plastic surgery clinics?
Yeah, I think we really focus on a concierge boutique kind of practice where each patient care is individualized, and there's 2 surgeons. It's me and my partner, Dr. Durand, and so there isn't... Some of these practices have 5 to 10 different surgeons, and there's a mix of things. We really focus and specialize in certain areas, and we want our patients to get the best experience in those areas. So we provide that high level service. We have an amazing facility here. I think this is one of the nice top rated facilities as far as state of the art goes. I have an amazing team. My team is really invested in not only the practice, but more importantly, the patients, and they care about them. So, we love to say everyone, has a great outcome. There's always patients who have issues and whatnot, and we pride ourselves in managing those kind of things. So, we take a very patient-directed approach, and on top of that, we take a very holistic approach to treating patients. So, we don't put any implants in. We don't like the foreign body, so we don't have any breast implants in our practice. We try to do narcotic-free anesthesia. We try to do gas-free anesthesia. So we try to eliminate all these kind of variables that don't create this holistic environment. So mind, body, and spirit all align together for a good patient outcome.
Amazing concept.
Yeah.
Honestly. And I think it's very important when a woman gets involved in this type of surgeries, because it's completely changed. It's changing their body again.
Yeah.
Right. And there's a lot of things to expect. What do you think that your patients that comes to you are most concerned with?
Yeah, the concerns are always one, it's surgery, so they always have the fear of going into surgery. And so it's my job and my team's job to make them feel comfortable. It's kind of like how you would want your family member or parents to have this amazing experience. So when
Right.
you feel comfortable going into it. So we want our patients to feel like they're our family members and have that comfort of coming in here and having open conversations and not feel like they're being rushed or dismissed or they're just another number. So we really are, again, that's one of my pet peeves. If a patient ever told me they felt like a number, I would take that very personally and try to find a way to change that.
Yeah, there's definitely many clinics that I've heard that it's like a factory.
Yeah.
And that's, quality.
Yeah.
It's quality versus quantity.
Right. So,
and in your case, you're focused more on quality of service.
Yeah. We're not here to do 50 surgeries a day. We want to do 3 or 4, whatever, how many surgeries we can do, but also provide that care that the patients need to have a good outcome.
Great. And in terms of going more into the removal process, tell me a little bit about the process, what to expect. Someone is thinking about doing that.
Yeah.
How does that work?
Yeah. So, patients come see us for explant surgery for a variety of reasons. There is something called breast implant illness, which is a autoimmune reaction to a foreign body. So we've been seeing a lot of patients who are suffering through that autoimmune process where they're having things like fatigue and brain fog and joint pain and rashes, just a long list of issues. And we kind of find out that it could be related to the implant. So they'll come see us to talk about an explant for that reason. The other reasons are capsular contracture, or really hard implants, rock hard. So they're solid implants, one sitting up here, one sitting down there. And so they want to talk to us about removing the implants. There's ruptures and leaking associated with the implants. So they'll talk to us about that. And then a lot of patients just are done with having them. They don't want the weight of them on their chest, their neck, their back. They're hurting. They're seeing a chiropractor all the time. Nothing's helping. They feel like they're carrying a heavy backpack all the time. So those are some of the common reasons that patients are coming to see us for implant removal.
And when they come to you, what should they expect from the first visit?
Yeah. So the initial is a consultation. So we do a in-depth discussion about medical history and reasons, trying to understand why they want to remove the implants and whether they're good candidates for it or not. And then once we go through that process, then we discuss what their surgical options are. So whether just removing the implants or removing the implants and doing a breast lift and reconstructing it. So we kind of talk about what particular procedure they're a candidate for. So we do consultation, procedure discussion, and then of course, most patients want to discuss it with either their husband or their family members and make sure they're good candidates for it. We give them the pricing and the quotes, which is, I think, a very important aspect of this process. So we are fully transparent about our pricing. So they look at the pricing, the consultation, whether we're a good fit for them and whether a good fit for our practice to do. And then they end up in surgery and go from there.
And how normally after the breast removal surgery, how much time do they have to wait, right, to get back into their regular life?
Yeah.
That's one of the questions that I'm sure a lot of people work and they want to think, when can I get back to my life?
Yeah. No, there's definitely a healing process that we have to really be strict about. So in general, for a patient to be back to going to the gym and doing regular exercises, it takes about 6 weeks But between surgery and 6 weeks, they're up and walking, they're moving around. And then as they get to that 2 to 3 week mark, they start doing more stretching and range of motion things. And then they're back to doing all their regular activities at 6 weeks. For working, if a patient is involved in heavy labor, so a police officer, hairstylist, things that require a lot of flight attendants requiring, we definitely have them restricted with their work, going back to their work. So desk jobs are typically 7 to 10 days, but if you're involved in heavy lifting or strenuous activity, sometimes you'll go back to work in 2 weeks, but with restrictions.
And do you feel by any chance that the demand for implant removal has increased in the past years compared to implantation?
Well, interestingly, breast augmentation or implant placement is still one of the top 3 procedures performed in the world and in the US. But with explants, it's definitely gone up quite a bit. I've been doing explants for about 8 or 9 years now. And, the statistics were, maybe like 0.7% of the patients were doing explants, and it went up to 11%, and now we're at 30% of patients. So the numbers have gone up quite a bit. I mean, we do about 350 to 400 of these explants a year, from patients from all over the world in the US. It's been amazing. But the numbers are continuing to increase. And, we were talking about, is it a trend? I just think it's going to become a norm part of plastic surgery. And because, patients when they see a plastic surgeon, they were never given the option to just explant. They're always told, oh, we're going to exchange them and put new ones in. And so you're on this continuous cycle of exchanging every 10 or 15 years. But now they have the understanding that they are able to remove it and have a reconstruction and have natural breasts. And so I think this is just going to become within the realm of plastic surgery.
And for a woman who has had implant, like you said, normally the doctor will tell you it lasts 10, 15 years. Mm-hmm. But let's say they start, a couple years before, they start seeing something, like some signs.
Yeah.
What are the things that are, that a woman should look for?
Yeah.
If something it's happening within her body, even though they haven't cross the mark of the 10, 15 years, because it could happen, right?
Yeah, it could happen. It could happen 2 years, 6 years. So regardless of the timeline, once the implants are placed, if a patient is experiencing pain that is different from the other side, or is new pain, swelling, redness, difficulty with upper body movements. They feel like the implant texture has changed. Like it used to be soft and now it's super hard. So any changes that the patient feels should warrant some sort of an investigation. So typically they'll go to their plastic surgeon, or they'll have a follow-up with their OBGYN, they'll do a breast exam, and then they'll start saying, okay, something's up, let's look into this.
Are the mammograms recommended when
for the issues?
Right.
So I mean, mammograms are good at looking at breast tissue, but they don't really tell us too much information about the implants. But that's always the first step, because when there's something wrong, everyone wants to obviously make sure there's no cancer or something bad's going on. So they'll do a combination of either a mammogram, an ultrasound to look at the implants. The best test that we have right now to look at the integrity of the implant and tell us whether it's ruptured or leaking or there are issues, at an MRI.
Okay. So
that gives us the most information about the implant. So the FDA recommends, so anyone who puts an implant in, FDA recommends getting their first MRI at 5 years, and then getting one every 2 to 3 years to track the integrity of the implants.
That's great, because a lot of people, I mean, I have no idea, but a lot of people may not know that they have to do MRIs.
They don't do it. And well, insurance.
And they only think that they have to do the mammogram.
Yeah. Insurance may not cover the MRI because it's related to a cosmetic procedure.
Okay.
So that becomes an issue. So some patients will have to pay out of pocket for it.
And they don't.
So nobody will do it unless they feel like there's an issue for it. But and then if mammograms start at age 40, unless there's some family history and you're suggested to do it earlier. So your mammogram might show something saying, oh, there's something off with the implants, X, Y, and Z. Recommend ultrasound or MRI, and then they'll go and do one of those studies.
And once the your patient has a removal of an implant, how does that affect their breastfeeding? Let's say someone has a baby after the extraction.
Yeah. You know, I've had quite a few patients get pregnant after the explant surgery, even doing a lift and reconstruction. And from what I know, I haven't had any patients who have had issues with breastfeeding after the surgery. Just because when we do it, we're not cutting into the breast ducts or the breast glands. So that tissue is kept in its natural harmony. And so when
That's a myth.
yeah, I mean, you know, like with breast reductions, we're removing tissue. There's definitely a 10% chance that you might not be able to breastfeed. But with explants, we're not taking out breast tissue. We're reorganizing it and restructuring it. So I have not had patients who have had issues with breastfeeding after getting pregnant.
And have you had any type of concern from your patients in terms of breast sensitivity, like nipple sensitivity, things like that? Does that affect anything?
No, it's a good question. Yeah, it's important. You know, some patients come in with pre-existing nipple issues, sensitivity issues from the original surgery. But if a patient has normal nipple sensation and we do the surgery, in the beginning, they're going to go in one of two directions. They'll either go numb or they'll be hypersensitive. Nerves are super finicky. They'll go in one of the two directions. And that'll happen. And then all of a sudden, the nerves will start healing and regenerating. And then between 6 months to 1 year, they'll get their normal sensation. Back. Yeah.
Okay, so that's good news.
Yeah, it's good news.
There's hope.
Yeah, it's rare to lose nipple sensitivity after this surgery. It can happen, and it happens like if a patient had like 5 or 6 breast surgeries, complications, they're at higher risk of having issues with nipple sensitivity just because of the amount of surgeries that they've already had.
And is there any specific, let's say someone has their implants and they're perfectly fine, but due to their age, is there any specific age that they should think about removing it?
No. I mean, we've done patients in their early 20s up to late 70s. It becomes a issue with, like, say if an elderly patient comes in and wants to remove their implants, we have to make sure it's safe for them to undergo the surgery and to undergo the stress of anesthesia. So there's no defined age on when to do it. You know, I've taken out.
So it depends on where you're a good candidate based on your health issues.
Yeah. So if you're in your 70s and you want to remove them, then we do a lot of clearances. So we have you go see a cardiologist and make sure your heart's going to be able to tolerate the stress of the surgery. If you had smoked in the past or you had some lung issues, we'll have you go see a lung doctor to get clearances. So as we get older, like 60 and above, we do start getting a lot more clearances to make sure it's safe to undergo surgery.
Okay. And do you also work with other doctors in making a decision whether the person is a good candidate?
Yeah, we do. We definitely align with patients, primary care doctors, and then again, depends on what medical issues they have. So if someone has a history of seizures, we talk to their neurologist. If they have a history of autoimmune issues, we connect with their rheumatologist. So yeah, we definitely collaborate and make sure that safety is always number one. So if someone tells us, be like, hey, this patient, she's not well controlled with, say her diabetes and she needs to have further workup done, then we're like, okay, let's get that taken care of, and then we'll come back another day to do your surgery.
For those patients that probably are looking at the video and they're feeling unsure in like, should I do it? Should I not? But I like my implants. But what are the benefits that you can mention about having a removal?
Yeah, no, it's
about saying goodbye. Like, it's okay.
Yeah, it's a tough decision to make. I think some patients are ready. They're ready. They know. They're like, get these out. They can't stand them. They're ready to get them out. There's two things with the implants. One is the cosmetics behind it, right? So you have to get ready to be used to not having that upper pull, that fullness on the top here. So clothing is going to change, the way you dress, and that appearance is going to change because you don't have the implants anymore. So you're
back to your old self.
You're back to being natural, all natural, which I think is great. Sometimes the implants may make you look top heavy or bulky, and in clothing they're showing, and we have a lot of moms come in saying that just doesn't fit our lifestyle anymore. So so you just have to get ready to undergo that transition from big breasts, larger volume, to a more natural look. So that's that part, and we always show pictures, before and after pictures, so patients can mentally kind of see, okay, this is what it looks like, because you forget, like after 10 or 15 years, you forget, you're used to seeing the way your breasts are. So
and do you think, I mean, I want to say that it's always going to change, even though it's like not really going back to your old self,
right.
but
Yeah,
you have aged,
right,
and you have gone through surgeries, so
yeah, no, 100%. You know, we do, people come and ask you, be like, am I gonna look like I did? They'll bring us their pictures before the implants, 20, 30. I'm like, this is what we're gonna look like, and I'm like,
now you were
no.
20,
Yeah,
okay, now you're 45 or 60.
Things change, you know, pregnancy, weight changes, breastfeeding. I mean, and then the implants, right? You're having a object that's stretching your skin and your muscle and your tissue, so it's gonna change. So we definitely counsel patients on that, saying, listen, realistic expectations need to be met, and you know, this is what we think you'll look like, and you know, you have to be accepting of that.
But top benefits: less back pain.
Yeah.
Better health, right?
Yeah.
In terms of mobility.
Yep. Yeah.
And definitely you're back to your natural self.
Natural self. Yeah. I mean, the things patients say, and immediately in recovery, we hear this all the time, is like, oh my God, I can breathe again.
Okay.
From not having the weight of their implants on their chest. So that's almost immediate. Neck and shoulder pain, gone. Migraines from the weight of the implants typically go away. Other stuff that's, you know, we have moms coming in being like, I can have my children laying on my chest without the implants there, and they feel connected to their children. Total tearjerker moment when I heard that the first time. I was like, I never even thought about that. Hugging people, you know, patients will say they hug people, kind of air hug almost, not getting a full hugging. Sleeping on your stomach, getting massages. Athletes, we've done bodybuilders, yoga instructors, golfers, tennis players, just having the implants in the way and affecting their game. I always tell them, I'm like, if your golf score improves, then you have to give me props for that when I remove them. So those are some of the functional benefits. And then, of course, with the breast implant illness and autoimmune issues, we see a lot of patients get better from not having that foreign body reaction.
Definitely. And I think it's there's a lot of more benefits than of removing it than of implanting it.
Yeah.
And people haven't realized until they've gone through all these years.
Yeah, you know, when you put in the implants, you're doing it for a certain reason, for a certain look. I understand patients who have like congenital, say, anomalies or deformities. One breast and the other are completely different,
and there's needs.
Sometimes
there's needs
to it,
medical needs.
And luckily, we do have other options for those patients. But yeah, it's, you know, functionally and physically, there's definitely a change, and I think it's a great option for patients who are done with them.
Can you think about of any other frequently asked questions that your patients have done to you that we haven't covered?
Yeah, you know, they like to talk about complications of surgery, right?
Well, that's a very important topic. Talk about complications, what to expect, how safe a patient should feel when explanting.
Yeah, it's a safe procedure when it's done, I think, in the right hands, because it's a unique procedure. There's not too many textbooks written about it. So my training in explants comes from a lot of my breast cancer reconstruction. And then I've used that in tailoring how I like to do the explant surgery. So just to get a little bit technical about the explant surgery, the way we do it is we remove the implant and the scar tissue that forms around it. There's a sac called a capsule that forms around the implant. So I take the implant and that sac out together, and then we have to reconstruct the breast. So that involves quite a few steps. One, the muscle, if it's damaged or cut, we have to reconstruct the whole pec muscle. This is a muscle that you do push-ups with, and it's a big muscle.
So it's not really like, because sometimes people are thinking it's just to cut, remove the implant, and close it. No,
yeah.
It's a whole...
It's a big procedure. It takes like 3 hours to do. It's with general anesthesia. You're asleep for the whole thing. And it's a very involved process to get you back to your natural shape. So, once we finish that and we reconstruct the breast and tighten up loose skin and do a lift if we have to do it, then you get into the recovery phase. Now, complications typically happen during the recovery phase, and those fall into things like immediate complications or complications that can happen later. The thing that I think will get a patient back into surgery was always worry about bleeding. So I'll give you an example. I did a patient from Orlando. She was flying out somewhere and decided to lift her luggage and put it in the overhead. She felt a pop and she had bleeding.
Oh my God.
And so she called me, oh my God, my one breast looks like it has an implant in it because the blood collects in that same pocket. And so she needed surgery to remove that collection of blood and then start from square one. So we call that a hematoma.
Right.
So that's one of the complications. And then we always worry about infection. But we do a lot of things. So obviously we have sterility standards over here, antibiotics, and then we also are big fans of hyperbaric oxygen therapy to help with wound healing. So bleeding and infection are the two most common ones. And then obviously I think dissatisfaction with the way the breasts look is a discussion. It's not a complication, but it's more like, okay, I'm done with the surgery and I just, shouldn't my breasts look more lifted or have more fullness here? And that's because the patients are used to having implants and now they're getting used to having. So we do have a solution for that, to improve the volume of the breasts that don't involve implants. And so we inject fat into the breast.
Okay.
So how similar they do the BBLs, the Brazilian butt lifts, we do liposuction and we inject fat into the breast to volumize it. Completely different procedures. BBLs, I don't do BBLs. I think there are too many complications associated with it. It's a very risky procedure. It's a little, injecting into the breast it's definitely safer than a BBL, but that allows us to volumize the breast and get
in a natural way.
In a natural way, yeah.
So there's hope. There's hope for those people that, oh my
hope.
God, I didn't have anything. Now I have to go back into not having anything.
Yeah.
No, you can still have.
You can inject, but it's not going to be like an implant. So that's the thing. It's softer. You're going to get half a cup size. If you're lucky, a full cup size. And what about athletic patients? What do you do then? Like people who don't have any fat, right? So now there's another solution for them. We can get over-the-counter fat. So it's fat that was collected from cadavers.
Okay.
And it's processed to remove all the proteins and whatnot, so your body doesn't react to it.
Right.
And you inject it, and it forms a blood supply and forms fat cells over there. So we're starting to use that. We have our first case coming up in January with that product. Yeah.
And since this type of surgeries, like you mentioned, are not covered by insurance, right, because they're optional. Do you guys offer in Enso Plastic Surgery any sort of financing programs or anything that will help patients do this?
With the insurance part, there's, we don't work with insurance providers, though insurance will cover some procedures. So say if a patient has a hard implant, we call it capsular contracture, insurance may reimburse the patient for a portion of that removal. And then if they have ruptures or leaking within a certain time frame, they may cover it. So say if a patient has a rupture, then we will document the rupture. We'll take pictures and videos for them, and then they can submit the claim and they'll get some money back. So we've had patients get up to $3,500 back in those situations by submitting the claim by themselves. So yeah, you can submit it to insurance in certain situations. We just don't work with the insurance providers. And then for financing, we offer Alpheon and Care Credit, which is it's a great option. They offer 0% for 2 years, so patients can have that, time to. These are expensive. All surgical procedures are. There's definitely a financial commitment to it. So I think it's nice to have those options so that you don't have to worry about interest collecting on a surgery that you did. And you can kind of have a nice payment plan to pay it off.
Yeah, because there's a lot of times our patients are just like saving little by little, like every paycheck. And but you don't have to wait. Like there's plans and there's options that the doctor will offer you. And you can get rid of that heavy lift. Doctor, as I came into the office, I saw a lot of nature a lot of decorations that really gave me peace. And I saw the name Enso. What does Enso means? Why Enso?
Yeah. Enso is it's a Buddhist symbol and name. So it's an incomplete circle. So if you see that circle around
the
it,
logo.
The logo it's one incomplete brushstroke, and it's used to signify a circle of togetherness. And for me, team is the important thing to make a patient have the best experience. So it's not just one person. So the whole team is a circle. The patient is in the middle. Now, why is it an incomplete circle? There are imperfections in everything we do. And so we learn and accept those imperfections and find ways to improve on it to get our patient to get the best experience. So I always am of if I have a good team that I trust in, so with the surgeons, the anesthesia, the management, the coordinators, everyone ties in this circle to give the patient the best outcome. So it's a Buddhist symbol. It lines up with my Eastern philosophies. It has a very Zen meaning to it. I think the logo is beautiful, and the symbolism behind the logo is beautiful. And so that's why I chose Enso Plastic Surgery.
That's amazing. And I do actually appreciate it a lot because, back into the things that I do, I'm also a graphic designer. And I design logos. So the explanation that you have done is perfect.
Thank
and
you.
That's exactly how every brand should be, because a brand should talk about your business, and it should talk about the experience that you want to offer the patients or the clients. And it's a relationship between a symbol and the experience that the person is going to have.
100%.
And you have resumed in the very special way what it means, and I think that's amazing.
Thank you.
And who came up with that? Did you come up with that?
I did, yeah.
That's cool.
Yeah, it took me.
Maybe you're a graphic designer in the bottom.
Well, the symbol is inherent with the name Enso. They fall together. So, and when I was kind of trying to come up with the name, I wanted to have. I'm of Indian origin, so I wanted to have something that reflected my Eastern philosophies. And as soon as I started learning about the Enso and reading about it, it just hit home.
So the word Enso, it's a thing, it's an item, or it's just a combination of a different letters?
So that the symbol you look, it's called the Enso.
Oh, that's called the Enso.
Yeah.
That is interesting.
Yeah.
You see, you learn everything new every day.
Yeah, it's
even when we're going to talk about plastic surgery and breast removal surgery. So that's exciting. Well, thank you, doctor, for having us, for this conversation. It has been a pleasure. I've learned a lot. I'm completely ignorant in this topic. So they're like, oh my God, what do you mean mold in an implant?
Yeah.
There's a lot of benefits in removing an implant more than implanting. So let's start thinking more like natural, accepting how we are. We're perfect how we are. And thank you for the work that you do, because you're helping all of these women, right, get back into their old self, and in a very professional way and safe way.
Thank you. Yeah, no, I appreciate you coming and discussing this topic. I think it's an important topic, and I think we've scratched the surface. I'm sure we could talk for hours and hours about it, but I appreciate all the questions and your time and learning about it.
If the people have questions, if patients have questions, how can they connect with you, with the office?
Yeah, we can put our number on the screen afterwards. My Instagram is DRDEVVDO, Dr. Devdo.
Okay.
If you can remember that. So
we're going to write it down.
Yeah, you can write it down. You can contact the office. You can contact one of our coordinators at Enso Plastic Surgery, or just go online at Enso Plastic Surgery and submit an inquiry, and our team will get to you right away.
Okay, so now you know Dr. Dev for removal of your implants, any other reconstructive surgery, any type of implants, right?
Any can.
And
body contouring.
Body contouring.
Yeah.
If we want to remove fat, remove the loose skin. It's a great opportunity. It's a great option that we have for those that are trying to lose weight. Including myself, I'm trying to, look better and for our health, right? Because sometimes the most important thing is to lose weight so that you can feel better.
100%.
And you can extend your lifespan, like I said.
Yeah.
So instead of adding, let's just remove.
Yeah.
And Let's call Dr. Deb for that. So anyway, thank you so much for having us. We're here in Entre Socios. It's been a great pleasure having this conversation with Dr. Deb from Enso Plastic Surgery. And any other questions that you might have, you can contact their office and follow our channel, Marley Media TV, here in our podcast, Entre Socios. Ciao, bye.
Juntos crecemos entre socios.